Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
Tristan was diagnosed with type 1 diabetes at the age of 7. I feared when he was first diagnosed that the challenges would be there. He was this little athlete that loved to do everything. He was just a smiley boy that just lit up the room wherever he went. And I thought, oh my goodness, is this going to make him, hide or, change him? I didn't want him to be ashamed. I didn't want him to think he had done anything wrong.
I remember my mother was in tears, and it was just, I didn't completely understand what was going on. Words that stuck out to me would be lifelong, challenging, difficult.
I was determined as a mom to not let him be any different than any other child. I was never going to hold him back and say no, he couldn't do something just because of type 1 diabetes. He was diagnosed and we left the hospital and I said, hey, you have a football game today and we're going to go. And we're going to be brave and we're going to figure this out.
She wanted to show me that I could do anything that anyone else could, even with diabetes, which was a big, big thing for me.
He's very independent. He always has been and always wants to step up to those challenges. At a young age, I pushed him, but yet I supported him. I think it goes back to these things that we did as a kid. He began giving his own insulin. He did his own work with the teachers. He talked to his coaches himself.
I believe I was in 2nd grade when I gave my first insulin injection. We were in a traffic jam and my mother was driving, so she could not give me the injection. So I had to draw up the insulin myself and inject it in the back of the car. I felt proud of myself and wanted to do it from there on out.
As a mom, I worry every day, so I wanted to make sure I set you up and you were ready and you just were ready to take ownership. I allowed him to really take that responsibility in understanding and failing, because I would rather him fail when I'm still around. There really is not a textbook for how to live with it. And so failing is really part of it, but it's a matter of how you respond from the failure as well. Words of wisdom that I would give parents would be empowering your child as soon as you can. I helped pave the way for him to take the next step to have the confidence. And so now when he's older and on his own, he has these skills already that he's developed. Tristan's process of becoming independent on his own didn't happen overnight. It was definitely not a sprint, but a marathon. In our book that we always say, he would take on a challenge and work at it and then go on to the next process. Well, I've had to really step back as a parent and allow him to manage this type 1 diabetes all by himself. Tristan handles everything in his care now that he's on his own. Having Gvoke HypoPen at school, it's provided me some comfort, knowing that he has this extra safety net with him and he's aware of how to use it and willing to educate others. The 2-step process of taking the cap off and injecting it is something he can do and is able to explain this process to anyone that might need to administer it. I believe Tristan is fully capable of handling his lows at school now. I trust that I've guided him long enough and kind of encouraged him to not hide it, and I think that is a big part of it.
I think my mother did a really great job raising me. It would have been a lot more difficult if I were learning how to completely manage my diabetes at the age of 17, rather than learning each part step by step over the years. I'd really like to thank her for really pushing me all these years. I don't think I'd be half as good or have any of the skills that I would need to be successful and be where I am today.
Thank you.
And that I love her very much.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke. Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.